Hello everyone. Today we are going to discuss about the continuation of the topics, that is child welfare agencies. Now we are going to discuss about the international agencies that is related to the child welfare. So under these agencies we are going to discuss about WHO, UNICEF, International Red Cross, FAO of the United Nations, World Bank Care, USAID, UNFPA, UNDP, ILO. So these are the agencies that we are going to discuss now. So one by one, let's see one by one. First one is WHO. So the full form of WHO is World Health Organizations. So a little bit about World Health Organization. It was established on 7th April 1948 with a headquarters at Geneva. The main objectives is of WHO is that they want the highest attainment of the standard of the health by all the individuals living in the world, and they are focusing on the theme that is health for all. Next, so we are going to discuss about little bit about the organization structure. There is main three wings they have. First one is World Health Assembly. So this assembly is usually done every annually in the month of the May, and they are going to determine the health policies and programs to be followed, and review about the past. They're going to review about the past year work, what are the works has been done, evaluations of the past year work are going to do, election of the members so will be done, and approve of the budgets will be done during this assembly. They also have executive board. So in this board they are going to have 34 members, and they are going to do meeting for 2 times in a year. The next one is secretariat. So the person is the head of WHO. Now we are going to discuss about the functions of WHO. So the first function of WHO is that they want to co-directing. They will give directions and coordination with the health programs throughout the world. The next one is they also focus on the prevention and the control of the communicable disease or other kind of the specific disease, any outbreak of the disease, for example COVID-19, etc. For that, for the prevention and control, they are going to work on it. Also they are going to help programs related to the improvement in the standards of the family health. They help in the promoting of the environmental health. So in the environmental health they are going to focus mainly on the sanitary, quality air, water, food, prevent from the hazards. The next one is collection of the data. So they will be doing various kind of the survey methods to understand the health statistic and to keep as a record. Communications and the publication informations in the form of the research or any kind of outbreaks of disease. They will be do research on it, how it is happen in the body of the body and how it outbreak in the world. And next one is strength increase research and strengthening the training institute. So by collaborating with the various training institute they will do various kind of the research. Next, activities. So what are the activities that we can see uh, which is done in the in India by WHO? So first one is eradication of the malaria. For the eradication of the malaria they have did various kind of programs, schemes. Control of the tuberculosis and communicable disease, health laboratory services and health statistics. For the public health administrations, they also helping in India for doing proper program for the reproductive and child health, dental health, medical rehabilitations, and then control of the drugs. So what kind of drugs can be used, what kind of drugs is harmful, so they are going to control it. Next one is for proper education of the medical and nursing peoples. And next agency that we are going to discuss is called UNICEF. So the full form of UNICEF is United Nations International Children's Emergency Fund. So it was established in 1946 by the United Nations with the headquarters at New York. So till by since 1949, so it was active in more than 170 countries. So usually they are focusing on the rehabilitations of the children which are affected by the World War. So what is the objectives of what is the objective of UNICEF are? So the main objective is to improvement of the health of the mother as well as with the children and mother. So next one is they are going to play a main role in all the programs that programs will benefit to the child directly or indirectly. So in every program they are also going to be involved. What are the function or the what are the field that UNICEF is directly or indirectly helping in India? So they UNICEF is helping in India in proper child health, proper nutrition, education, water supply, social welfare for the population. Now regarding the health, what are the things they are helping in India? First one is proper development of the rural health service. So in that they are helping in proper development of the PAC in every part of the India, especially in the villages, controlling of the communicable disease, proper organization of the immunization program, and encourage or proper providing of the vaccines in whole India. And next one is training programs given to the medical peoples. And next regarding the nutritions, they are developing or they are organizing various kind of the applied nutrition programs in India, agricultural extension services, school health services, regarding the helping dairy project, prevention of the malnutrition among children. And next one is providing supplementary nutrition to the health like providing of milk powder, etc. Next one is in the education. So in the educations they mainly focus on the proper provision of the laboratory in every colleges and school, arranging various workshops or supply of various kind of audiovisual aids, books, or various kind of the education materials to the schools of the nursing or children's in free of course. The next one is water supply. So to get the proper good supply of the water in India, they help in digging of the well in various rural area, and also they promoted proper use of the groundwater. Next one is social welfare. So in that they are helping directly about proper proper organization of the reproductive and the child health services in India, contributing to primary health care. The next one is they also help in proper promotion of the child safety and safe motherhood. So UNICEF is promoting a campaign that is called GOBI. So in that they are using four strategy. So GOBI is the full form of the four strategy. First one is they are going to focus on the growth chart. Whoever child comes in the primary health care or child living in the village area, they are going to check the growth chart. Okay, next one is if there is need of any kind of oral rehydration, they are going to give breastfeeding, immunization. So these are the things that they are going to do during through this campaign. And next agency that we are going to discuss is International Red Cross. It was established in 1863 by Henry Dunant with a headquarters in Geneva, Switzerland. So the service which are mainly provided by International Red Cross Society are protection of the war wounded peoples, refugee and prisoner. So in that they are also focused on the children's also. So first one the activities is first aid, proper provision of the transport and the hospital care. So you can see here they also focus on the mother and the child care, vaccination, proper vaccination of the children's mother. And next one is health and hygiene promotion, strengthen hospital management, blood donation, drug equipment supplies. So next agency that we are going to discuss is called World Bank. So by the name you might be understand, bank means they are the kind of the agency that financially they are going to help to the developing countries. So usually they provide a financial to the developing country in the form of the loans, so that they can increase or they can raise the living standard. Even the India is taking lots of money from the blood bank, sorry, World Bank. So it was established in 1944 with a headquarters in Washington. Now to see the activities of the World Bank, so first one is they sanction the loan. So they give the loans to the specific countries, the countries who are very low in the income, low in the income like India. So they are going to help in wiping out the poverty, hunger, and the unemployment in the particular country. And next one is promotion of the international threats. So and then the balance and manner between the developing country and already developed country and the developing country, to they are going to maintain a proper international threat. And next one is they are going to set up various kind of the policies about giving of the loan and the financial management in every countries. And next one is they also give not only they give the loan not only to the underdeveloped country, they also provide loan to the private agency also. This will be helping for the expanding their industries in the countries. Okay. And next agency that we are going to discuss about is CARE. So the full form of CARE is Cooperative for American Relief Everywhere. So this is established in 1945 with the headquarters at Atlanta, Georgia. So usually it is active in 84 countries, and services which are provided by CARE are mainly about provision of the logistic, food aid, long-term development assistance. In India, CARE are help the CARE is working along with the various kind of NGO for supporting various projects or the programs like ICDAs. And next one is integrated and nutritional program. These all programs are done by Indian government to along with the CARE. Next one is better health and nutrition programs, anemia control project, improving women health project, health for the adolescent girls, child survival project. Next one is women's reproductive health and family spacing projects. These are the projects that usually the CARE is working along with the government of India. And next we are going to discuss about the USAID. So the full form of the USAID is United States Agency for International Development. So it was established in November 3rd, 1961 with the headquarters at Washington, and works it is USAID is present all over the world around in hundreds countries. So they are uh, they are helping they are mainly designed to improve the health of the Indian people. Okay, so what are the things that has been done by USAID in India is first one is eradication of the malaria, medical education, nursing education, health education, water supply and sanitation, control of communicable disease, nutrition and family planning. The services that provided in overall, first one is economic prosperity, to improve proper economy in the particular country they are helping. They also strengthening the countries for democracy and the good governance, protecting the human rights, improve global health, advance food security and agriculture, improve environmental sustainability, educations to the people who need it, society prevention and recover from the conflicts and disaster. And next agency that we are going to discuss is called UNDP, so United Nations Development Program. It was established in 1966 with a headquarters in New York and works with 177 countries. The objectives are to help the poorest nations. The poorest nation, they are going to help, they are going to identify which one is the poorest nations, and they are going to help to develop their human and national resources. And they also provide various kind of the project that cover every economic and social sector, like industries, agriculture, education, science, health, social welfare, etc. So working area, what are the working area they have? First one is poverty reduction, is that area that mainly they are working. And next one is achievement of the Millennium Developmental Goal, democracy, government, crisis prevention and recovery, environment and energy protection. They also work closely with our Indian national AIDS control programs, women empowerment and human development. Next agency that we are going to discuss is UNFPA. So the full form is United Nations Fund for Population Activities, established in 1969 with the headquarters located at the New York. Missions of UNPFA is that um, they provide or they deliver a world where every pregnancy is wanted and every birth is saved, and every young person is going to be potential. Okay, so what are the service they provide is that to develop the national capabilities of for manufacturing of the contraceptive, populations education programs, of family planning. Okay, so these are the things that services. In India, they are working along with the programs, right, like RCH2, NACP3, okay, National Rural Health Missions. Now we are going to discuss about the ILO, that is International Labour Organizations, established in 1919 with the headquarters located at Geneva. So mainly the this kind of organizations are working to improve the working and living condition and working population of all over the world, and they also trying to prevent from the child labor in India. First one, what are the purposes of developing this kind of organization is that first one is a proper social justice should be there, promotion of the proper social justice. And next one is to improve the condition or the working standard or living standard of the laborer, promote the economic and social stability. The next one, how the ILO is helping for the child welfare is that they are going to prevent from the child labor, okay, through various kind of programs. So one program is the child labor program. So through this program they are trying to eliminate all the child who are working in any part of the India. So in that they used to prevent it and they try to eliminate it. So that is called INDUS. INDUS means India US Child Labor Project. This come to the end of the international agency related to the child welfare. So I hope you understood. If you have any doubt, you can comment below, or you have any contents you need, you can also comment below. Then I will be uploading in the next session, next video. Thank you.